morning. Beautiful day in New York City. My mask matches my tie. Always a good way to start the day, even if it is coincidental. We have from my far right, Commissioner Tony Annucci, who is the Commissioner of New York State Department of Corrections. Tony has been with me from day one. He's done an extraordinary job. It's one of the hardest positions in state government, I think, running the correction system. And Tony's done an outstanding job, so I want to thank him. It's a pleasure to be with him today. To my immediate right, Melissa DeRosa, Secretary to the Governor. To my immediate left, Gareth Rhodes, Deputy Superintendent of Department of Financial Services, and Kelly Cummings to Gareth's left. Kelly, as you know, is Director of State Operations, and she has done a remarkable job. You know, this has been a stress test for governments all across the country. Government had to perform. It was not about just talking, right? It was not about rhetoric and pontification. It was about performance. That's what government is supposed to be able to do. We lost sight of that for a long time. We thought government became a political exercise, and if you took the right political positions, then you did your government duty. No, no, no. Government has to work, it has to operate, it has to function. And we've seen under this COVID stress test what governments could actually perform and what governments couldn't perform. All those logistical things, setting up testing sites, coordinating labs, doing the contact tracing. It was hard. Government never had a challenge like that before, not in my lifetime. And I'm very proud of the way the employees of New York State government responded, and I'm proud of Kelly Cummings' leadership. Let's talk about today where we are. We're day 145, a bright sunny day. Good news, all good news. 706 hospitalizations, lowest since March 18th. Number of deaths, 13. We don't like to lose anyone, obviously, and they're in our thoughts and prayers, but that is also good news relative to where we were. 3-day average of lives lost is down to 8. That is good news. Number of tests yesterday, 69,000 tests, 811 positive. That's a 1.1% positive rate. That is also good news. You look across the regions of the state, you see all good news. You see a little tick in the capital region. It's the Albany capital region. We had just about 30 positives from one July 4th party. One party, 30 positives, 28 positives. You understand why we say one bad event, one bad group can be a real problem. One party, 30 people. Remember what we went through in New Rochelle. One super spreader, first hotspot in the United States. One person can make a difference. But all the numbers are good. You look across New York City, likewise, all the numbers are good. Because it's good, we then say good news. Data is clear. We congratulate New Yorkers because they climbed the highest and hardest mountain, and we are on the other side. The big caution, the but we don't want to climb any more mountains. It was not fun. It tested the character of the people of the state, tested the competence of the government, and New Yorkers did it. But we don't want to do it again. And we're wary of new threats that are on the horizon. And that is the bad news, is the concerning trends that we're seeing around the country primarily. And it's important that we learn the lesson of what we have gone through. This is not that COVID descended on us yesterday. It's been 6 months. In New York, we were ambushed. Virus came from Europe. Nobody knew. Nobody told us. We woke up one morning, and the spike was already happening. We were ambushed. That's not where we are today. It's been 6 months. We know what COVID is about. We've been talking about testing and tracing and quarantine. It's been 6 months. Let's at least learn the lesson of the past 6 months. Let's learn the facts of the past 6 months. We're still having this same inane political discussion. Well, you should reopen right away. No, that was never the question. And now we have 6 months of experience to know what happens when you do that, right? It wasn't about do we reopen or not. The question was always, yes, you reopen. Of course you reopen. You reopen as quickly as you can. But you have to be smart in how you reopen. You have to follow the science and the metrics. You still have today people who are operating politically suggesting just reopen. Just reopen. Even President Trump isn't saying that anymore. And he was the main booster of that theory, right? And we see what happens when you rush a reopening. We have the proof of 6 months of experiments. Some states reopened right away. Some states, New York, said no. Let's do a phased reopening. Let's study the metrics. And let's do it intelligently. And in the long run, that will be better, because if we just reopen immediately, we run the risk of the virus going up and then we have to close. That is exactly what has happened. It's not a question of political theory. He said, she said, conservatives say this one said. We have the results. We went to the laboratory, we tested it. New York began reopening May 15th. I said at that time, we expect the virus may go up once you start reopening. Why? Because the activity is going to increase. More activity, more spread. We started reopening. You know what happened? The number went down. It didn't go up. It went down. I was wrong. To the positive. I thought it was going to go up. The number went down. Because it was a smart reopening, because we're on top of it, we're studying the data, etc. Look at the states that rushed to reopen. And look at what is happening. Look at our curve versus their curve. It's undeniable. So why are we still having the same political argument? We know that rushed reopenings don't work, and the states that rushed to reopen are now reclosing. That's another new COVID word, by the way. I don't think there is any such word as reclosing. I'm sure Zach will point out that I used a word that doesn't exist, reclosing. It's a new word in the state of New York. I just proclaim it a new word. They are reclosing. How did that help the economy? It didn't. It set the economy back. You look at where this country is versus other countries on the globe, we're behind the other countries. We got the virus from Europe. Europe now has the virus under control. They're quarantining us because they did a better job. So, learn the lessons and let's stop this non-productive political debate that is still going on in this state and in this country. No politics, follow the facts. That's what we did from day one. We do face a threat from the states that rushed the reopening and were not ready. You turn on the news, you listen all day, there's still problems in testing. States don't have tracing operations. States have some counties opening, some counties closing, some counties have this plan, some counties have that plan. They rushed the reopening, they were not ready for the reopening, or they just were not competent enough to handle the reopening because it was rushed. And we're seeing that increase, it's undeniable, and it is a threat to New York. We now have 39 states with an increasing threat. We know that this virus travels. We know that. We know we are not an island in the state of New York. We know that we cannot hermetically seal the state of New York in our own little bubble. So when you see the virus going up in these other states, it poses a threat to New York. Our quarantine enforcement is serious, and I want people coming into this state to know that. States have never done border control before. We had to scramble. It was another COVID first. But we have police at airports. When you land, there is a police officer there. You have to fill out a form as to where you're going. It is illegal to leave the airport without filling out the form. And then we can follow up from the form. We have some people coming to New York saying, oh, I didn't know that there was a quarantine. I don't know how they did not know there was a quarantine. There is a quarantine, and we are serious about it. At the same time, we stand ready to help our fellow Americans and the other states. I have said very clearly, anyone who needs help, anytime, anywhere, we will be there. Why? Because, first of all, it's the right thing to do. I sat here and I said to the people across this country who watch the briefings, we need help. I said, please help us. New York was in the midst of the crisis. I asked for doctors and nurses from across the country to come help us in our emergency rooms. 30,000 people volunteered. I mean, how awesome is that? Think about that, 30,000 nurses and doctors who knew the threat. You're a nurse, you're a doctor, you know the threat about working in an emergency room, right? It's not like you're going in blindly. 30,000 people volunteered. I mean, how beautiful, how generous, how courageous. I'll fly to New York and I'll go into your emergency rooms. I said at that time, we will never forget what people are doing for us. And I said at that time, we will repay your gratitude. New Yorkers mean what they say. And New Yorkers are an honorable people. When we say we will never forget and we'll be there for you, we mean it. I represent New Yorkers. The words came out of my mouth. I said them on behalf of all New Yorkers. We are going to honor what we said. We will be there for you. And we're working with governments now, Atlanta, Houston, Savannah. We're working with other governments, whatever they need. We understand they're struggling. We understand the pain. We were there, and anything we can do. That's the right thing to do. Also, practically, we know that if we don't control the virus in the other states, that we are then in danger of dealing with a second wave. Not the second wave they talked about, which was a mutated virus comes back. It's a second ricochet of the first wave, because we're still in the first wave. But the wave bounced to the West Coast and is now bouncing back like a wave in a bathtub. And that's our quarantine, etc. So we understand that we have a self-interest in all of this. And the expression I like to use, a virus anywhere, is a virus everywhere. That's what we should have understood. That's what we should have understood when we first saw the virus in China. It wasn't China. It was a matter of days before it was here. And by the way, it was a matter of days before it was here. Also, we're monitoring a second threat, which is the rising COVID rates among younger people. You look at the age brackets, it's basically flat or down except for one group, 21 to 30 years old. And it has ticked up 4 points. That is a significant increase in a short period of time. And we know why. We have been talking about it. You can see it on the news. You can see it in the newspapers. You can see it in social media. It's not hard to understand what is going on. It's hard to deal with it, but it's not hard to understand what's going on. You get groups of young people. It's warm. They've been locked up for a long time. We like to socialize. I get it. You don't socially distance. You don't wear masks. The virus spreads, and it is happening. To young people, this is not the time to fight for your right to party. I respect your right to party. I fully respect it. I would enshrine it in the state law if you want to know. You have the right to party. But let's be smart about it, right? There is an attitude that young people are immune. You are not. 21 to 30, the virus can kill you. And if it doesn't kill you, you can bring it home and give it to someone inadvertently, and it can kill them. So they are laboring under false pretenses. And I've had dozens and dozens of conversations, and I've heard the most inane responses. They just don't know the facts. They are dealing with assumptions that are just not true. So first, the local governments have to step up and do the enforcement job. I understand it's not politically popular. I understand it's hard. Some parts of the state, we have health personnel, local health personnel who have gone in, who have been accosted. I understand that. But you have to enforce the law. Just because people don't like the law that you're enforcing doesn't mean you don't enforce the law. Send them with a local policeman. If you need help, we'll get you help with the state police. But we have to enforce the law, and the local governments have to do it. New York City, NYPD has to enforce the law. Not just the sheriff's office. When New York City wants to enforce the law, you know who enforces it? The NYPD. Enforce the law. State Liquor Authority and the state police are going to step up their efforts dramatically, but they can't do it without the local police. I've said that from day one. Also, we need to get the facts to the young people who are participating, and they need the facts. And we're going to start a video ad campaign that is targeted to young people to communicate some of the facts and the misimpressions that they have. Can you run the ad, please?
I work out every day. COVID won't kill me.
I'm 24. COVID won't kill me.
I have antibodies. COVID won't kill me.
It's been a long week. COVID won't kill me.
I'm 25. COVID won't kill
I'm
me.
partying outside. COVID won't kill
I
me.
don't need to wear a mask around my friends. COVID won't kill me.
I'm 23. COVID won't kill me.
If I haven't gotten it yet, COVID won't kill me.
I'm young. COVID won't kill me.
Famous last words. Don't let them be yours.
Be New York tough and smart. Socially distance. Wear a mask.
Mask up, America.
That's what you hear when you talk to a lot of young people. There is a total misconception of their vulnerability to this disease. And we hope that makes a difference. Also, Washington is now discussing a supplemental bill to help with the COVID crisis. There's gridlock and dispute as to whether or not they're going to fund state and local governments to help. It's very simple. If they want to get this economy back running, you have to fund state and local governments. There is no economic model or research that says the economy is going to bounce back without funding state and local governments. The economic research says the exact opposite. Listen to Chairman Powell. Even the Wall Street Journal says the data shows if you don't fund state and local governments and they have to do dramatic cuts, that's going to hurt the economy. These Republican senators who say, well, they don't want to make the taxpayer pay to bail out blue states, Democratic states. initially, Democratic states are the states that had the most COVID cases. Not true anymore. You now have Republican states that are suffering worse than Democratic states, right? And this hyper-political Washington attitude, why should a Republican Senate give funds to Democratic states? It's not even true. It is the epitome of hypocrisy. These Republican states have been taking money from the Democratic states for years. For years. You look at who gives and who takes, if you want to get to that basis. New York gives $29 billion. New Jersey gives $18 billion. Massachusetts, Connecticut, California, they all pay more into the federal till than they take out. You know who takes out? The Republican senators who are making this argument. Virginia takes out $82 billion. Maryland takes out $42 billion. Senator McConnell, Senator Rand, we want to save taxpayers' money. You know how you save taxpayers' money? Don't take so much money out of the till. You take out $37 billion more than you put in. You want to help taxpayers? Put some of the money back that you have been taking for years. That's how you help taxpayers. Question of federal troops in New York City. The president has sent troops to Portland, Oregon. The president just sent troops to Chicago, Illinois. The president is talking about sending troops to other cities. The president suggested he would send troops to New York City, troops, federal agents, etc. I spoke to the president about it. I don't believe there's any justification to send federal troops or federal agents to New York City, and I told him that. There is no federal property that is endangered that could justify the federal government having to send agents. The constitutional law is clear on this. The nation does not have a federal police force to deploy in their discretion. Policing is left up to the states. The president and I had a good conversation. He said he would not be sending troops into New York City. He did not say, period, ad infinitum, but he said that we would talk before he did anything. And New York was not included yesterday in the announcement that he was sending troops into Chicago. If the president were to do that, of course, we would sue. I believe it's blatantly unconstitutional. But a lawsuit in this case would also not be highly effective as a short-term measure. There are numerous lawsuits. Portland, Oregon has sued the federal government. Mayors have sued the federal government. The lawsuits take time. And for that lawsuit to work its way through the courts, you'd be talking about a significant amount of time. I think if they sent in federal agents, I think it would be inflammatory. I think it would be pouring gasoline on a fire. And that's the last thing we need in New York City. So the president said he heard me. He said he wouldn't do it. He said that we would talk if anything changed. It was a good conversation, and I'm going to hold the president to his word, and I have no reason to believe anything other than that. And the president said if there was a change, we would have a conversation first. But I'll stay on top of this and monitor it, and we'll see where we go from here. But so far, the president has not said anything different than we had on the conversation. In the meantime, New York City must focus on quality of life and essential services. The rationale used in Chicago was crime. We have had crime increase in New York City. We have to get on that. The homelessness, the graffiti. So we have work to do here in New York. Long term, for New York City, we will need a significant effort to restart the economy. And I've said that from day one. reimagine the economy, rebuild the economy. You have a lot of people who left New York City when COVID was at its height. You then have this transformation in the economy where people were home for 4 or 5 months working from home, and they were introduced to a new way of doing business. And you're seeing businesses across the country starting to modify their behavior. Maybe I don't need to be in the city. Maybe I don't need all that commercial space. Maybe I can have half my workforce work from home. Maybe I can stay in my summer house and work from my summer house and not pay the New York City income tax. So this is a very delicate moment that we're in. You put on top of that the crime increase, put on top of that the scenes of looting that we've seen, put on top of that issues with the homeless, issues with graffiti. It's a bad combination that we're going to have to address. Now, one thing at a time, we have to get through the current crisis, which is dealing with COVID. And we have to make sure there's no second wave, et cetera. But we're going to have work to do to restart and rejuvenate the economy. There's no two ways about that. One of the best things we've done is the amount of testing that we have done. You look at these other states that are still having trouble on testing. They're having long turnarounds on testing. Testing is your eyes and ears in this situation. Everything is anecdotal without testing. You have the number of hospitalizations, but that is a lagging indicator, and it's too late when the hospitalizations are going up. The testing was the only facts to tell you where you were today. And you need facts, you need guideposts to plan your strategy. We test more than any state. We test more than most countries. We've also tested, we do so much testing that we can refine the testing and we can test subgroups. We tested our subgroups of essential workers, because I was always worried we made essential workers continue working. Did we put them in harm's way? Essential workers were below the level of the overall community. New York City, the overall community is 19.9. Fire department was 17, transit workers 14, healthcare workers 12, NYPD 10. Why is the fire department high? It's fire department and EMT workers. So the EMT workers are really on the spot, right? They're the ones who are showing up. Look at the healthcare workers, 12%. How can the healthcare workers be at 12% when overall in New York City it was 19? How can people working in an emergency room have a lower infection rate? They're dealing with positive people all day long. How can that be? Because these work. These work. That's why, and that's why New York State was the first state in the United States to have a mask order. But we've done more and more testing, and we did testing in DOC's facility, Department of Correction facilities, okay? I've talked enough. Press test. You're the press. This is the test. We tested incarcerated individuals over 55 and over. How many individuals are there in the state prison system who are 55 and over? See, you like to ask questions, but you're not so good on the answering questions. Any guess? Come on. So, how many?
10,000.
10,000. 3,900, 55 and over. Why 55 and over? Because COVID affects older people more. What was the percent positive? How many people? Percentage is hard. How many people of the 3,900 tested positive?
3.
How many?
3%.
3%? Any other bids, offers?
I'd go lower. 20?
How many people? What's your number?
I'd go lower than 3. I'd say 2 or 1.
2 or 1?
1.
77 positives out of 3,900 people tested, which is 1.9. So I just want to applaud Commissioner Annucci, and I want to applaud Kelly Cummings. This is a congregate population, 55 and older. They were all asymptomatic, by the way, because symptomatic people had been tested. These were asymptomatic people, the entire population. So that was a job really well done. Because again, these congregate facilities are where we've seen a lot of trouble. So very good, because we are New York tough, smart, united, disciplined, and loving. Questions?
Governor, regarding the situation, you said that you seem to speak to the president and successfully kind of held him off for doing something drastic, like bringing in federal troops or agents to assist with law enforcement, but then you said it is first on the state's part to act, or purview to act in a situation. Are we at a tipping point yet? I mean, do you feel as though we're at a point where crime and graffiti and homelessness are at a crisis point and something needs to be done to kind of course correct the way the city is handling it?
I don't believe it is an emergency that would justify a state emergency declaration or a federal emergency declaration. You know, for the federal government to come in, there's only two possible rationales. I don't believe either are legal, by the way. One is fear of damage to federal property. That was the early conversation in Portland, Oregon. There were federal statues and they were being destroyed. Destruction of federal property or a public safety emergency that is endangering lives and is not being adequately addressed by the local government, city, state. I don't believe those situations exist. I don't believe they exist for the federal government. I don't believe they exist for the state. That would be for the state to declare an emergency and come in basically in a takeover capacity. I did say during the nights of looting, it was a very serious situation. And had that not stopped, and had the city not deployed more NYPD officers, and if that looting had continued, that I believe was an emergency situation. So I don't believe we have an emergency crisis for state takeover. Do I believe graffiti is a growing problem, homelessness is a growing problem, crime is a growing problem? Yes, yes. I've said it. We've been talking to city officials, elected officials, city government about it. I've said it publicly multiple times. But yes, it is a significant and a growing problem, but not one that justifies a state takeover or a federal intervention, right? There's a spectrum and there's degrees. Yes, we have a problem. Not a problem that requires federal intervention or state takeover.
But Governor, here's the question: Governor, are you saying that the
Mr.
crime?
Martian, I'm not going
Are you saying
anywhere.
that the crime, that the homelessness and the graffiti are keeping people who may have left for their summer homes or Connecticut or other states, preventing them from coming back into the city and helping the city have an economic resurgence or rebirth?
Moshe, I'm not saying we know cause and effect now. We know the elements that are in the environment, right? The elements in the environment are people left because of COVID, because at one time we were the COVID hotspot. People left the city. We know people leaving the city for their homes in the Hamptons or Hudson Valley, young people going back to wherever they grew up, Chicago, etc. We have to get them back. We know complicating that is going to be this economic transformation that is happening, where people are now working from home and they're reevaluating their basic business modality. They're doing that all across the country. Maybe I don't have to go back. Maybe I can keep half my workforce home. That's happening everywhere. We know you also have, happening at the same time, an increase in crime. You had the incidents of looting. You know, for people who are in this city now, they will say the homeless problem is worse. The graffiti problem is worse. So you have all these elements happening at the same time. And it is not a good combination. of elements. Which ones are more impactful than other ones, I don't know. My instinct is, if I had to guess, which I shouldn't do, but if I had to guess, my guess would be the business transformation is going to be have the most potential impact. If businesses just decide, I don't need to pay for $25,000, 25,000 square feet of space. I don't need it. They worked from home for 4 months. It was fine. That could be a problem. And the other factors, I think, are aggravating factors. Also, one more aggravating factor. The main attractions for New York City. Well, why do you pay a high rent? Why do you pay the income tax surcharge? Greatest restaurants in the world. Greatest cultural institutions in the world. I love Broadway. All right, but those things are not operating now. So that's an element.
Cuomo, you mentioned the prison system. You failed to mention that the state's only tested 10% of inmates across the board, and among all inmates, not just 55 and above, the infection rate, I believe, was about 10%, as opposed 10 to 15%, as opposed to that's according to the data on your website on July 10th. So I'm curious if there's any plans to increase testing among inmates, and if that's something that is ongoing, and if you'll release any further information. The most recent data is from July 10th on that.
Yeah, let's just make sure we're talking apples and apples. The earlier test we did was an antibody test. The antibody test says, did you have the COVID virus in the past? That was that 10%? Does anybody remember? Well, whatever it was about 10%. This test is what's called the diagnostic test, snapshot. Today, this is what the infection rate is. We tested the 55 and over asymptomatic. We test anybody who's symptomatic. Asymptomatic 55 and over, just on the theory of, well, these people are in a vulnerable class. Let's see what is the percentage who are infected now but are asymptomatic. And those are the numbers we saw today. Is that right, Tony?
Do you have that number for the overall population, or no, as of today?
What number? Go ahead, Melissa.
No, I just wanted to make clear. So all along, we tested prisoners by the same standard as we tested people outside of prisons, right? So if you had come into contact with someone who was known to have coronavirus, if you were symptomatic, then you got a coronavirus test, and then you either were hospitalized if that was necessary, or you were quarantined off, and you were then monitored as the virus progressed. So prisoners through the entire length of coronavirus were treated the exact same way as the general population. What the governor asked the docs to do, which they did, was every single prisoner who was 55 and over, regardless of whether or not they had been in contact with someone who had coronavirus, and all these people were asymptomatic, because if they were symptomatic, they were already being tested. Just blanket test every single person, so we know. So we have a gut check what's going on in the prison system, make sure that what we believe to be the case was actually the case, and that there hadn't been any outbreaks within the New York State corrections facilities. So we just did a blanket, every single person 55 and over. The website actually hasn't been updated with those results. It's going to be updated immediately following this press conference. And what we found, which was really great news, is that there had been no outbreak, and that the 55 and older population, it was 1.9% for positives, and then those people were appropriately either taken to the hospital if that was necessary, although in this instance, and Tony, correct me if I'm wrong, because they were all asymptomatic, I don't think that that was necessary, or they were then quarantined, and they've been monitored.
I'll tell you why we did it. There have been, if you have trouble sleeping at night and you watch many hours of news programming, which is an affliction, double affliction that I have. You have had outbreaks across the country in prisons that have been quite significant. Think about it. In some ways, it's worse than any other congregate facility, right? Because people are really on top of one another, more than in OPWDD facility, more than in a nursing home. So you've had prisons that have had serious outbreaks. And that's when we decided to go just test everybody, 55 and over, even if you are asymptomatic.
Governor, I want to
Peter?
ask you about unemployment. We've heard from people who still for months cannot get through. They call from 8 o'clock in the morning to the end of the day. They send an email, they get a reply, which says call. And they just still cannot get through
Okay.
since April.
First of all, I get the overall situation. This is not a New York situation. It's all across the country. Remember what the federal government did is they passed a new unemployment law with new requirements, new regulations. They then gave it to the states and said, administer it. I talked to governors all day long. You look at how New York has handled this versus the other states. We have done a markedly better job than any state, even with a much higher number. You look at the number of people who have not yet gotten their check compared to any other state, we've done markedly better. Now, I know, at the same time, if you're the one who's waiting for your check, it's a problem. The people you are hearing from are not generally people who are the run-of-the-mill application. There are a lot of applications that are problematic. Not everybody gets a check. You have to meet certain federal requirements. Your income, your situation, your bank account. And we wind up with a lot of people who file, and then there's an issue. And look, you also have a real situation at the same time going on where you've had some massive frauds that have been going on. I mean, hundreds of millions of dollars, right? Because you put a big pot of cash out there and you say, call and get your check. You're seeing scams all across the country. So we're working to accelerate the checks getting out the door, but I have a little voice in my head that says, beware when the pendulum comes back and there's an audit afterwards that says New York State gave out checks to people who shouldn't have gotten the money, which is inevitable. And then I'm going to say, well, we were rushing to move the checks very quickly because we wanted to get money out to people. And everyone in this room is going to say, but you should have never given a check to a person who didn't deserve the check. You should have audited them first. And you're going to be right. But let me give you Melissa has the numbers, but I just wanted to give you a little context.
So the way that we calculate this is we look at claims that are 3 weeks or older, because on a sunny day in July when the economy is running perfectly, it takes DOL about 2 to 3 weeks to process a claim and get money out the door. So as of this morning, there are 1,259 claims that are 3 weeks or older. So any claim right now other than 1,259 are within the 3 weeks that on a sunny day in July when the economy is humming would take to turn over. On the issue of the phones, I actually had thought that the system had greatly improved, and I would like to follow up with you afterwards to hear from you're hearing from and see if there's something specific we can do to address that.
How many people have we processed?
3.2 million people have gotten $34.4 billion since the start of this.
And Peter, of those 1,200, there are going to be issues with people. It's not everybody who asks for a check gets a check.
So people who are dialing their phone all day, every day, can finally get through to somebody and say, hey, what's going on with my claim?
That is, Kelly, do you know?
The call center, the calls actually have improved a lot. There was a glitch on Sunday night with some of the PUA claims, and it caused many people just this week to call. That was resolved, and people are now getting paid, but that caused a little bit. It was basically a technical error, but it has been resolved. So that there was an uptick this week.
This is not just this week. This is 2 weeks worth, call after call after call, nothing.
To me, that doesn't sound right.
Yeah, especially because the numbers are down so low.
We brought in Google to do a website. We hired 3,000 people, 3,000 to work the phones and the website. It's the volume was that incredibly high. And you have to check the financial information for every person. If you only have 1,200, how many were processed?
There's 1,259 that are older than 3 weeks.
1,200 older than 3 weeks. And how many processed totally?
3.2 million.
3.2 million processed. 1,200 over 3 weeks. And then what percent of those have issues that have to be worked out? Or, by the way, out of 3 million, what percent is the fraud going to be?
Governor, we continue to hear from person after person about testing results taking more than a week. It happened to me, for example. And I know you've talked about the difference between the state and city labs and the national labs, but it's still perplexing for a lot of people to hear that, you know, the average turnaround is 2 to 3 days when they're waiting sometimes up to 14 days. I'm wondering if you can elaborate on the discrepancy. Have you seen the average time gotten worse in the past few weeks since we last talked about that? And if there's anything else the state can do to speed up test results?
Here are the facts. The testing, amount of time to get back a test is going up across the country. Period. Why? Because the national laboratories that do nationwide testing, Quest, LabCorp, BioReference, etc., they are getting overwhelmed with all these states who are now going to the national labs. Caveat: why aren't the states developing their own labs in-state? We have 200 labs in-state. They should be doing that rather than just going to the national labs. True, but that's more complicated. In New York, about 70% of the tests are done by national labs. There is no delay in that 70% of labs because we appropriate the tests among those labs depending on their volume. So if one lab is getting slow, we have 200 labs in the queue we can allocate among the 200. About 30% of our tests are done by national labs. That 30% is getting longer. It is, because it's running into the national backlog. Not a New York State backlog, but a national backlog. So 70% of the tests, no issue. 30% of the tests that were going to the national labs, they have slowed down because the national labs have slowed down. And the federal government is working on supply chain issues for the national labs, which is part of it. The states nationally have to do a better job of using their local labs to increase capacity. But that is going on. And Gareth can give you some specific numbers. Here's what's worse. What's worse is it's going to get worse because you're going to come into flu season. And right now, we have basically said to all the labs in this state, work 7 days a week, 24 hours a day doing COVID tests. And they are. Come flu season, that's their busy season. And they're going to start to say, we have to run flu tests also. The flu tests, we fear, we're trying to figure a way around this, but we don't have one right now. The flu tests will eat at the capacity for the COVID tests. That's compounding this fear of a second wave in the fall. But Gareth?
If you look at how testing works in New York, we have about now over 800 testing sites. These are not labs, these are testing sites where if you want to get tested for COVID, you would go there, sign up for an appointment, and they would swab your nose. And then each of those sites has to then pick a lab where they would send that specimen. So as the governor said, about over 70% of testing, those aren't going to the labs that have what you're seeing longer delays with. For example, we had about 69,000 tests yesterday. More than 50,000 of those did not go to the labs that are seeing long delays. And of those over 50,000, the average delay was about 2.6 days. The median is about 2 days. So yes, while you are getting those reports, and it's obviously any lag is not desirable, the majority of testing is in New York is happening on a much shorter time frame, which most other states right now can't say, and that's because of the work the governor did and to develop this huge network of labs here in the state that are doing that kind of testing.
But Luis, those are your numbers. Let me just make sure I heard them right. We did 69,000 tests. Of the 69,000, 50,000 had a 2.6 day turnaround. 9,000 were longer, whatever that was. But 50 of the
other 20,000, 30,000, how long is that?
well, it's 50 to 69, so the other 19, right?
The other 19,000, you're seeing between 6 and 10 delays, 6 to 10 day average delays. Now, you'll sometimes have longer than that. Sometimes you'll have shorter than that. The labs also can prioritize what kind of samples are coming in. If it's someone who is symptomatic, of course, there's testing required before people have elective surgeries. They can prioritize those as well. But again, the ideal form of testing is this rapid result, point of care testing. You get the result very quickly. Until we have that on a mass scale, we're always going to have to rely on a system where you're sending to labs. And the key here is that every state needs to do what New York has done and develop this internal network of labs. We have some labs that do 10 tests a day. We have some labs that do thousands of tests a day on sometimes less than 1 day turnarounds. And if you had that on a nationwide scale, it would take off the pressure on these large national labs, and you'd see much better turnaround times across the entire country.
This is, just to make it a little more complicated for you, this is the tension between the federal government and the states on testing. You know, when they say, the federal government will say, the states have to do a better job, states say, we need more help from the federal government. It's true on both ends. Some of the national labs say our problem is a supply chain, and a lot of their supplies come from China. They need the federal government to help them with the supply chain. The federal government says to the states, you can't all be going to national labs. There are only 10 big national labs. You can't have the entire nation going to the 10 labs. States, you have to use the smaller labs in your states also, which is harder for a state to do, right? Go organize 200 labs. Each lab is small. You're only getting 400 tests here, 400 tests here. It's hard to do. It's a lot easier for a state just to say, I'm going to contract with National Lab, and that's it. So it's both ends of the equation.
Governor, can you detail how the state police and the SLA are stepping up enforcement in terms of social distancing and gatherings? And also, a lot of these gatherings are not at bars and restaurants, so what do we do about that? Also, where is that PSA going to be running where young people are actually going to see it?
We're going to run it in New York State. We're going to make it available to the Ad Council, which runs the ad nationwide.
But I mean, like in terms of social media, I mean, you know,
Oh, you asking me
kids, like where they can see,
what stations that
yeah, I mean,
what TV social young people? Well, I know because I watch that.
Media.
That's what I watch. I watch the young people because I'm like a 21 to 30 in terms of orientation. Do you know?
Because we are targeting it at 20 and 30 years old, as I'm sure you can imagine, we're going to be doing a big social media push. So Facebook, Twitter, Instagram, and a lot of the news sites that we know are heavily trafficked by the 20 and 30-year-olds.
I relate to the 20, 30-year-olds. I do. I'm like, culturally, I'm there.
Also, how is the SLA and state police stepping up the enforcement?
SLA, this is not
especially the ones, I mean, no, SLA can't be involved in the ones that are not at bars and restaurants, which has also been a problem.
Yeah, the main problem, yes, you're right, there's a lot of elements to the problem. House parties, right? July 4th party in Albany, 30 positives. The main problem are bars, restaurants, because 21 to 30, you don't just have a gathering on a street corner and do bird watching. Alcohol is often involved. The alcohol has to come from a bar or a restaurant. That's why the overwhelming majority are in connection with a bar or a restaurant. Not to belabor this, in New York State, we have one license for a bar and a restaurant. We don't have a separate bar license and a restaurant license. Most other states have two licenses, one for a bar, one for a restaurant. When they opened outdoor dining, they opened just the restaurant licenses. None of them, very few, opened bars, okay? The president now says young people don't go into bars, right? Most states did not open bars. Since we only have one license, we reopened bars and restaurants. But it was for outdoor dining. It was not for outdoor drinking. Bars that are now serving outdoor drinking, that was never legal. There was no bar license that allowed you to have a block party in front of the bar. That was never allowed. And this question of, well, food with the alcohol. Any bar, by our current law, existing law, let's call it that, any bar had to have food available. There is no bar that only serves alcohol. To be a bar, you had to have food available. Soups, sandwiches, etc. More than just hors d'oeuvres, chicken wings. You had to have some substantive food. The lowest level of substantive food were sandwiches. Even to be a bar, you had to have food available. We opened outdoor dining. Dining is you go with your friends, you sit at a table, you stay at the table, and you only connect with those people at the table, and the other table is socially distanced. What they have done with outdoor drinking, you don't sit at a table and drink. You mingle, you move, you say hello, you hobnob. That was never what outdoor dining was. So the SLA and the state police will focus on the licensed entity by the state liquor authority, the bar or the restaurant holder. And we are going to be aggressive about enforcement. Having said that, the state liquor authority and the state police cannot police the entire state. I don't know how many thousands of bars we have. We need the local government to do it. We need the NYPD. We need the Nassau Police. We need the Suffolk Police in the Hamptons. We need the Erie County Police. We need the Albany Police to do their job. Yes, go ahead.
Regarding the new, thank you, Governor. Regarding the new restrictions put out by your administration yesterday, mandating that bars and restaurants may only serve food, a person, for example, can buy a $1 hot dog and not eat it, but just, buy it just so they can hang around and drink. Are these rules actually effective?
Well, there's a number of laws here. One of the laws is called the Open Container Law. You can't drink an alcoholic beverage on the sidewalk. Forget the SLA law. You can't drink an alcoholic beverage on the sidewalk. Zach violates it all the time. But it is illegal. So there are laws to enforce besides the SLA food law. But everybody knew what the difference between dining and drinking, right? It's a fundamental difference. Who didn't ask a question?
Governor, regarding the elections, the upcoming elections, when do you plan on detailing what the states will do to ensure all absentee ballots are counted and safe?
We are going to learn lessons from this last election. COVID has forced us to rapidly transition to all these new systems. You close down schools. We had to rapidly transition to remote learning. And frankly, the system wasn't perfected. And you see all these issues pop up. You couldn't walk into a hospital. We had to deploy to telemedicine. You saw all these issues pop up. You can't vote at a voting booth anymore. You can't be online. Everything by mail. And you hyper-energize that system to do the transition. And you see a lot of issues pop up. So we're going to study those issues, see how we can make it better. And then there's a whole electoral time clock by when ballots have to be mailed, et cetera. But I want these boards of elections to first learn some lessons from all the things that went wrong and take some time to correct them before we do it again.
Follow-up question?
Good. Last question.
Governor, I have a follow-up question.
And I don't mean to be...
Follow-up, important. Really. You gotta
Okay,
take
but
it.
Governor, can I just ask about, because I know what you said about the bars and restaurants for the last week, but I think there's still some confusion out there. A block down from me on 57th Street, there's a bar. They have tables, nice partitions in between. You order a scotch and soda. They come and they bring a scotch and soda to you on your table and they sit down. What you're saying now is that's illegal?
No. That is outdoor. We facilitated outdoor service for bars and restaurants. There was no outdoor bar service really, right? We expanded that greatly to deal with these issues of people want to socialize and the restaurants were dying. Any bar has by the current license, they must serve food. You go to the bar, you sit down at a table, you look at the menu, you order your scotch and soda, and you order what they had to have on the menu, soup, salad, etc. Fine. That's fine.
Okay, but they don't have a menu for food, so they're illegal.
No, they do. They must, by their license, have food available. They must. Even a bar, the old corner bar that Zach used to go to. By a bar license, you have to have food available. By a bar license. There is no bar that can just serve alcohol. Going back, follow-up question for Ms. Kramer, because you can't say no.
It's on
I can't say no. You can
It's
say
on,
no.
You can say no, but.
Yeah, but then you know what
have to deal with
happens.
me.
Yeah,
So
I know.
anyway, It's on graffiti. There's been a huge increase in graffiti in New York City, not just on public buildings, but everywhere. You go into every neighborhood, there's graffiti everywhere. New York City zeroed out the dollars to clean up the graffiti on private buildings. There's $0 for it. Plus, 311 has decided to stop taking any complaints about graffiti. How is that a good idea, and how is that going to make the city come back?
Look, I mentioned it in my presentation, right? So I raised the issue before you raised it with me in your follow-up question, just from time.
A legitimate follow-up question.
Yeah, it's got to be clean. It's graffiti. We've handled these issues before. Graffiti is not COVID. It's not. It's spray paint on a building. We've had it for many years. We had it on trains. We had it on buildings. We had it on walls. You enforce the law. It's illegal to do graffiti. Enforce the law. And when you miss it, clean it up and take it off, like we used to do.
How do you clean it up?
Well, look, there's money to do what you need to do. And graffiti sounds like a little thing. It's another sign of decay. And what we're trying to do is say to people, New Yorkers on the way back, New York did a great thing in handling COVID. You look at our numbers compared to everywhere else, nobody did what New Yorkers did. And New York City's coming back better than ever before. We understand the challenges. And people need to see that progress. They certainly don't need to see deterioration. And graffiti is something we can handle. We're not talking about curing COVID. Get the graffiti off the building. Detergent, power washer, brush, get the graffiti off the building.
The mayor to spend the money on graffiti.
I'm telling the mayor, the cleaning up the city is important. You have a lot of negativity in the air now. Positive, progress, move forward. Thank you, guys. I'll see you again. I'm not going anywhere. Always a pleasure. Always a pleasure. That's a legislative change that has to be made by the legislature. I would support the legislative change. What's wrong with
Cuomo chips?
What's wrong with Cuomo chips?
Yeah, what's versus the Cuomo chips?
Don't you like Cuomo chips?
First of all, how did I get associated with chips? I don't know. There's nothing wrong with Cuomo chips. I enjoy them. They do not suffice in the existing law as a bar serving food. This is a law going back to the old days. The bar had to have food available, soups, sandwiches, even Cuomo chips were not enough. Thank you, guys.